So here what we're doing is looking at passive hip extension, seeing what's going on with the hip, the mobility there, and then we also test the strength of the lateral pelvic stabilizers. In this next part, what we're going to do is really just look at the different angles of motion in the hip, looking for any restriction through any parts of the hip motion. In addition, we test the internal and external rotators of the hip, looking for any tightness or signs of weakness. Once again, we do the same thing with the iliopsoas muscle, which is our primary hip flexor muscle. Then we'll go into some orthopedic tests as well, looking for any potential signs of hip pathologies or restrictions, anything like that. We always like to compare bilaterally or both sides just to see if there's a difference. Typically we'll find that there's asymmetries in the body throughout, which can lead to different pain patterns on the side of restriction or on the side that is more mobile, just because of compensation and some other factors. Once again, we go through and look at the hip just to see what kind of motion there is, if there's any signs of possible pathology. And then we do a simple abdominal brace, and that just evaluates to see strength of the abdomen and if there's any problems in the low back.